Hi, I'm Kelsey. I'm one of the VAD coordinators here at Lehigh Valley Hospital. So we are going to do a weekly dressing change. So first you want to open the packet. You always want to make sure that you're opening the dressing away from you first, making sure that you're only touching the corners to keep your sterile field. There are directions on the very top if you need them for step-by-step instructions. You can just place them to the side. There are two hats. One should be placed on the person doing the dressing change, and the other hat should be placed on the patient. Masks will be provided to you in a box, and each person needs a mask, the person doing the dressing change and the person that's getting their dressing changed. Now that the masks are on the patient and the person placing the dressing, now we can start the dressing change. There are two sets of gloves in here. One is the clean set that you will take the old dressing off with, and the second set is the sterile gloves. I'm going to place the sterile gloves on now, considering this dressing is already off. You always want to do your dominant hand first. Once your sterile gloves are in place, now you're prepared to do the dressing change. You have 3 ChloraPreps here. Okay, these are what you're going to use to clean the area. In order to activate the ChloraPrep, you need to pinch the side. Once it's pinched, you'll see the water start to come. Now you're ready to clean the site. You always want to start from the center first and work your way out, using friction to make sure you're cleaning the area well. And again, once you go out, you cannot go back in. And you're going to do it 3 times. Once the area is clean, you want to wait for it to dry. Don't wave your hand over top of the area. You want it to air dry. While you're waiting for that to happen, now you can place your Silverlon. All right, so you're going to open up the Silverlon packet. Along with the Silverlon, you are going to open up the sterile saline wipe. You want to press the saline wipe against the silver part of the Silverlon. The moisture is what activates the silver that's going to help prevent infection. Next, you're going to put the silver around the drive line. You want to make sure that the silver part is on the patient's skin. When you're looking down at the site, you want to be able to see white and not silver. Next part of the dressing change is the protective wipe. You want to make sure that you're putting this in the area where the dressing is going to go. It does not go on the driveline exit site. And again, you're just going to do it in that rectangular motion where that dressing is going to go. Again, you want to wait for that to dry. When it's dry, it's going to become tacky and sticky. That's what's going to help the dressing stick to the patient's skin. After the area is dry, you are now prepared to place the dressing on the patient. First step is the big dressing. Okay. Notice it does have a clear window. You want to make sure that you can see the Silverlon through that window. All right. I usually pull it apart a little bit so that you have proper placement. Once you're satisfied that you can see the exit site through the window, you can place the dressing on the patient. The second part of the dressing, you want to make sure that the driveline is going to come out through that perforation at the bottom. The second part is the interlocking piece of the dressing. And how that is placed is you want to make sure that you're going underneath the driveline. Get it as snug as possible. And then pull it apart one piece at a time. This is what locks that driveline in place. The last part of the dressing changes the Foley anchor, and this is very, very important to be placed on the patient during the dressing change so that you help prevent driveline infections. My suggestion is always to interlock the driveline before placing it on the patient. You want to make sure that you're keeping the skin prep so that you can use it on the other part of the patient's skin where you're going to be putting that Foley anchor. The Foley anchor has one piece that has a hole in it. You put the driveline in the middle and then pull this piece through the hole and interlock. So that's what I'm going to do now prior to placing the Foley anchor on the patient's skin. Now that it's interlocked, I'm going to place the Foley anchor in the spot where I marked. And now the dressing change is complete.